extra or unusual sound heard during a heartbeat. Murmurs can range from very faint to very loud. Sometimes they can even mimic a whooshing sound. There are two types of heart murmurs. The first is innocent murmurs. These murmurs are not caused by heart problems. They are common in healthy children without heart disease. The second type are abnormal murmurs. These murmurs most often are caused by an acquired heart valve disease that develops as a result of another condition such as infection or even aging. In children, this is most commonly caused by congenital heart disease. Before I explain these heart murmurs, it is important to review how blood flows through the heart. The heart is a four-chambered organ which either bring blood to or carry it away from the heart. The blood first enters the heart through the right atrium. A contraction forces the blood through the tricuspid valve into the right ventricle. Next, the right ventricle contracts, forcing the blood through the pulmonary semilunar valve into the pulmonary artery. The blood then travels to the lungs where it receives oxygen. It will drain out of the lungs through the pulmonary veins and travel to the left atrium. The left atrium contracts, forcing blood through the mitral valve into the left ventricle. This major muscular pump contracts, forcing blood through the aortic semilunar valve into the aorta, where it will be carried to all the tissue of the body. What are the types of abnormal murmurs? Systolic murmurs and diastolic murmurs. There are two types of systolic murmurs, and each type has two subtypes: ejection systolic or mid-systolic murmur and pansystolic. First, we will introduce the ejection systolic or mid-systolic murmur. The two subcategories of ejection systolic murmur are aortic stenosis and pulmonic stenosis. Aortic stenosis is located at the second intercostal space near the left sternal border. The murmur radiates to the carotid, where a crescendo-decrescendo sound, including a harsh S4 sound. Stenosis murmur is located at the second left intercostal space near the left sternal border. The second category of systolic murmurs is the pansystolic murmurs. The two subtypes are mitral regurgitation and tricuspid regurgitation. Mitral regurgitation is located in the fifth intercostal space near the left midclavicular line and radiates down the axilla. The sound has been known to blow high-pitched sound. It is especially noticeable after shaking your tail feather at Zumba or standing up. Tricuspid regurgitation is located at the fourth left intercostal space near the left sternal border. The sound is characterized as blowing coarse and musical and most audible in inspiration. The diastolic murmurs. There are two types of diastolic murmur: the early diastolic murmur and the mid-diastolic murmur. Each have their own two subtypes. The first of them is the aortic regurgitation. It is located at the fourth intercostal space near the left sternal border. It may be heard blowing soft and visible carotid pulsations. Regurgitation is the second subgroup of early diastolic. It is located in the pulmonic area and can be accentuated by having that patient sitting up and leaning forward. Mitral stenosis is the first of the mid-systolic diastolic murmurs. It is located at the mitral area apex, left sternal border. It exhibits a low-pitched rumbling, opening snap, very noticeable when laying to the left. The second mid-systolic diastolic murmur is the tricuspid stenosis. It is located mid-diastolic near the left sternal border. It blows a high pitch and is best heard while laying down at the peak of inspiration.